Joint injuries.
Musculoskeletal injuries can occur in many different ways, and there are four basic types.
The four types of musculoskeletal injuries are a fracture, which is a break, chip, or a crack of the bone. A dislocation, which is a separation of a bone from a joint. A sprain, which is the tearing of ligament at a joint. And a strain, which is a stretching or tearing of a muscle or tendon. This is usually called a pulled muscle.
First state is the same for all muscle, bone, and joint injuries. Keep the person comfortable as possible and avoid further causing pain.
Just remember the acronym RISE. R stands for rest, I stands for immobilize, C stands for calm, and E stands for elevate. Get the person to stop any further movement and help them to get into the most comfortable position without causing too much pain. Immobilize the injured body part to prevent further damage. Apply ice or cold pack to decrease pain and swelling. Cold will also construct the blood vessel and minimize internal bleeding. To protect the skin, place cast or cloth between the ice and the skin. Cool the affected area for 20 minutes every hour for the first 24 to 48 hours. If possible, elevate the area above the level of the heart to slow the flow of blood. Do not elevate the body part if it causes more pain.
If medical attention is delayed, the injury is minor, or you're in a remote area and no one cannot access you.
Immediately immobilize the injured area with a splint, sling, or bandages to
Lessen pain and prevent further damage.
A splint is a device that keeps the injured body parts in place. There are three types of splint: soft, rigid, and anatomic. Soft splint include towels, pillows, bandages, and slings. A rigid splints can be made from boards, metal strips, or folded newspapers and magazine. Finally, an anatomic splint is using a healthy body parts to immobilize an injured area like fingers or toes.